All right. Hello, everybody. Welcome to the Office of Pre-Health Advising new student webinar for summer 2022. Just as a heads up, this is our recorded session, but we're really excited to be talking to you all today. So to go ahead and get us started, I just have a quick little agenda for us. So the real goal of this session is for you to learn more about the Office of Pre-Health Advising, or OFA, as we'd like to refer to it. You're going to get a chance to meet our staff. You're going to have a chance to know a little bit more about your peers. And we're also going to cover some important knowledge for pre-health students who are getting started here at CU Boulder. Now, if you've got any questions, feel free to email us at prehealth@colorado.edu and we'll answer your email as soon as possible.
Okay, a little bit about our staff and allow us to introduce ourselves. I'm Dana Parcher. I'm the director for the Office of Pre-Health Advising, and the person you were just hearing from is Katie Chang, program coordinator. But we also have two pre-health advisors that help out with all of our pre-health students, workshops, and all kinds of other parts of our office, and that's Emilio Medina and Pamela Stacy.
All right, and we don't have our pre-health ambassador here with us today, but I wanted to tell you a little bit about Fatima. So Fatima is a sophomore here at CU Boulder and works as the pre-health ambassador for our office. So Fatima is majoring in integrated physiology, or IPhi, as you'll hear people refer to it, and she's interested in dentistry, particularly pediatric dentistry. So some of the things that she enjoys doing in her free time is she likes to go for long drives with her friends, hiking. I know many of you are interested in outdoor activities around CU Boulder, so hiking is a great one to get involved in. And she also really likes hockey. And then as far as student involvement goes, she's part of the Pre-Dental Club, the Muslim Student Association, and the Pakistani Student Association as well. And then Fatima wanted to share a little bit of information with you all. So some of her favorite study spots on campus are in the student engagement and collaboration area, which is located in the University Memorial Center. She also really likes the patio outside of the Center for Academic Success and Engagement, and study rooms in KIT, or anywhere outside of the Restandi building. So if you have any questions about being a new student, you can actually email Fatima this summer, and you can email her at healthproambassadors@colorado.edu. And just as a heads up, we have these slides available so that you can get access to the links that are shared in this as well.
All right, one of the first things we want to talk about is, what does it mean to be pre-health? So many of you may already have something in mind for what that means, and you're likely right, because it means a career in healthcare. You're interested in something beyond CU Boulder in medicine, physician assistant, dentistry, optometry, could be lots of different areas, and we're going to talk about those areas in a few. But basically, you want to pursue a career beyond your undergraduate career at CU Boulder in a health professions program of some kind. And that career journey is quite a long one. It can be messy, it can be complicated, it can be full of twists and turns. And it can often feel like you might be alone on your journey, especially if you're choosing an area that you feel like not a lot of other people are choosing. And that's why we're here. So we are here to help you with your journey, help make sure that you're feeling like you have support along the way. We help you with your questions, help you get connected, help you reflect on your experiences, help you evaluate how they're going. And if you ever change your mind or feel like you want to try something new, we're here to help you explore that as well. Being pre-health can be really complicated and be really challenging, but it is definitely doable. We see our students go off to amazing careers, helping serve other people all the time, and we can't wait to help you as well.
All right, so to talk a little bit about some of the services that we offer, there's a lot of really great ways for you to connect with our office. So one of those is through what we call our What I Should Know, or WISC sessions. And these are designed to help you learn about specific professions. Sorry, just a second. And these are to help you learn about our different professions. We also offer a number of workshops related to professional school requirements and preparation. So that might not be something you're worried about quite yet during the summer, but you'll definitely be checking out later on. We also offer one-on-one advising meetings where you can meet with one of the pre-health advisors to help talk through your specific situation. We also are available to answer questions over email. That's often a great place to start, especially if you've got a small question that you want answered. So our email is prehealth@colorado.edu. Along with these services, we also are going to add you to a Canvas course to help with each stage of your journey. Now, you might be familiar with Canvas a little bit already because I know we have our new student welcome material in there, but you're going to get added to our PreHealth Foundations Canvas course as well. And that's really nice because it gives you access to information about becoming a doctor or a dentist or a physical therapist 24/7, and it'll be there to provide you with answers to many of your questions. We're also going to give you access to the pre-health information listserv. And this has a lot of information about different job opportunities for pre-health students, volunteer opportunities, as well as listing information sessions, not just related to CU Boulder, but related to different medical schools or other professional schools as well. We also have a really fantastic calendar of events on our website, which you can check out now. It's located on the prepare section of our website. And again, we'll make these slides and links available to you, but that provides some information on different events that are going on, whether that's something through our office, like those What I Should Know sessions and workshops, or information sessions offered at other universities. And so you might still be wondering, what does it mean to be pre-health? There's a lot that goes into it. And one of the things we want to point out, pre-health is not a specific major, but it's rather what we call a designation that gets added to your account. So you can sort of think of it like a badge that gets put on there, and it shows us and your academic advisors that you want to work with OFA. And this will also help you book appointments with our pre-health advisors and let you sign up for our workshops and What I Should Know sessions. And so you might be wondering, why not have pre-health as a major? Well, we want you to choose a major that you're excited about, something that you're passionate about and interested in. You can be any major you want, and sometimes your major can set you apart when you're applying to these different professional schools. And we know everyone's really, really, really excited about the healthcare fields, but sometimes people do change their minds later on, and having a major that's specifically called pre-health would be a little bit less helpful in that situation. And so really our takeaway for this is when you're thinking about what you should major in, it's whatever you want. So health professional schools want to see that you're passionate and excited about what you're studying. And they also want to see that you're able to balance the different coursework that you have. So that could be balancing some major requirements as well as those prerequisites for professional schools. And so one of the things, though, I do want to point out for our incoming fall 2022 students, so the students who are interested in working with pre-health, integrated physiology, or IPhi, is the most popular major for students who want to do pre-health coming to CU Boulder. And then the second most popular major at the moment is molecular, cellular, and developmental biology, also known as MCDB. And then after that, it's actually exploratory studies. So we have a lot of students coming in who are interested in the healthcare fields, but may not know exactly what major they want to do yet. And that's definitely something you can also connect with our office to talk about. Now, our pre-health ambassador, Fatima, couldn't join us today, but she wanted to talk a little bit about her experience choosing her major. So one of the things I will say, some majors have requirements that line up more closely with professional school prerequisites. And that was actually one of the factors for Fatima when she chose her major. So she was deciding between integrated physiology and psychology, and she was essentially interested in both, but integrated physiology lined up a little bit more closely with the dental school prerequisites. Plus, she felt like she was really excited about taking anatomy and physiology, which not all dental schools require. So that was something she would have to take as an IPhi major and wouldn't necessarily have to do as a psychology major. So she sort of thought about like, what's going to get me where I want to go? What do I like learning about? And also she's got the opportunity if she wants to do a psychology minor. So just sharing a little bit of information there.
So we offer services for a lot of different pre-health areas. These are the most common: dentistry, medicine, nursing, therapy, and more. Our most popular are in order: medicine, followed by physician assistant, physical therapy, and nursing. But we offer lots of support for all of these. These in particular here on this slide have extremely intense or competitive application processes. They are to professional schools, not necessarily graduate programs. And so they really up the bar when it comes to your process. For example, medical school requires you to fill out this application that alone takes on average 40 hours for a student to fill out. And our office can help students make sure that they're filling it out in the right ways to help give them the competitive edge they need to get seen by medical schools and get them interviews for medical schools as well. And all of these require so many different nuances and intricacies. And our staff at the Office of PreHealth Advising are much more skilled in these areas than a lot of others, but it doesn't mean that you don't have a home here in the Office of PreHealth Advising. You can be interested in just about anything, and we can help you find your path to that. So some examples might be like audiology or genetic counseling. That's one of my favorites to talk about. Medical technology, healthcare management, what else? Public health, rehabilitation science, that's a really cool one. Developing prosthetics, that's really cool. So we help students get to a lot of those different areas. Some of the most popular there might be genetic counseling, public health, and audiology. Definitely see students from a lot of different areas.
So switching gears a little bit, we want to talk to you about the difference between pre-health advising versus academic advising. And so this isn't an exhaustive list of what we do or what academic advisors do, but more of a way for you to help you think about who you should talk to depending on the types of questions you have. So pre-health advisors are really focused in on helping you find a path to become a strong applicant for professional schools. So they do this if you're thinking about evaluating your skills and experiences, and also your pre-health advisor will help you with self-reflecting on this kind of thing. They can also make recommendations related to different career paths. So exploring what your options are and trying to figure out which one might be a good fit for you. They'll talk to you a little bit as well about those professional school prerequisite classes, so the classes required to get in, but they don't advise on major classes or major requirements or cover things like registration logistics. That would be something to talk to your academic advisor about. And so your academic advisor focuses in more on helping you navigate major requirements and being prepared to graduate from CU. And again, there's definitely other things academic advisors help out with as well. But in terms of our office versus their offices, you would want to go to them when you want to talk about the classes required for your major, talking about staying on track to graduate, and also making long-term course plans. That's something you want to talk to your academic advisor about. And also discussing things like policies and procedures, especially those related to registration. And they can also be a really great resource to help incorporate academic experiences and goals into your degree plan. So sometimes different offices on campus, offices associated with the different majors, might have specific research or internship opportunities related to your major, and your academic advisor would be a great person to talk to about how to find out about those types of opportunities.
So some of the questions you're going to be wondering to ask your academic advisor, but also maybe the Office of PreHealth Advising, is about AP and IB credit. And this is one of the most common things we get asked from incoming students. Unfortunately, a lot of professional schools do not accept AP or IB credit. They do this for a lot of reasons. One is actually to your benefit. Those schools don't always know where you left off in terms of your course content knowledge when it comes to AP and IB credit and where you might start with at the university. And so they just really blanket statement that the university course content is just going to give you that stronger, deeper knowledge of the course content, and that's kind of what they lean towards. So a lot of them don't really accept AP and IB credit, but many pre-health students and our office really suggest that you do retake these courses. It really can be to your benefit to set you up for success later when it comes to pursuing the next level of these courses. So for example, if you came into CU Boulder and you had AP credit for chemistry 1, let's say, and you jumped into chemistry 2, and you didn't do as well as you thought, maybe you earned a B or a C or something else, that's really not going to look as good on your academic transcript as it would be if you were to start with chemistry 1, which you already have background knowledge of and you're already feeling confident in, and you pulled an A in it. Also, by the way, as you probably know out there, your GPA is extremely important as a pre-health student. And so what better way to start your very first semester than succeeding really well in your first semester classes, even if that means taking chemistry 1, even if you came in with AP credit for chemistry 1. So it really is to your benefit to maybe consider retaking those classes. It is definitely something our office recommends. And you can always talk to your academic advisor about where's the best place for you to start. There is a link when you get a copy of these slides, there's a link here on that slide that gives you a really great way for you to determine specifically for chemistry, should you start with a certain chemistry or, what area you should start with. Oh, my apologies, that's on the next slide. This link is really good for letting you see all the different medical schools that accept AP or community college credit courses. Now, we've done the legwork for you and looked through that whole list. You're going to see hundreds of schools there, and you'll see a lot of them do not accept AP or IB credit. Some of them will accept community college credit, which is totally great. And some of you will have some of that credit as dual enrolled high school student entering CU Boulder. We do prefer, and a lot of professional schools will prefer, that you take upper level courses, not at a community college, but at an accredited four-year institution like CU Boulder. And that's typically going to be the case anyway, because a lot of community colleges don't offer upper level courses, so it should be fine. One thing though to consider is talking to your academic advisor about what you took at your community college and what you feel confident in taking here in the next level. If you took something, let's say biology, our community college biology 1, and you want to jump right into biology 2, well, guess what? We have a lot of different biologies to choose from, and they all go into depth in different ways. And so talking to your academic advisor about what you took at a community college versus your next step here is really going to be crucial for your success your very first semester. The other thing on that link is that that link is going to have a list of a ton of different schools, right? You might be dead set on saying, I'm only applying to these 5 schools and they all accept my AP and they all accept my community college, so I'm just going to do what I want, which is also totally fine. This is your path and your journey. However, we recognize that along the way, you might learn about a different career that you never heard before, and now you're falling in love with it, and now you do need to retake those AP classes, or you change your mind, or you want to do something else entirely. And so maybe it's to your best interest to just start out strong and retake some of those courses. You can always talk to your academic advisor though about this option and about what's best for you and your learning style and your course content knowledge that you already bring into CU Boulder. Okay, so we've also done some work to give you some great classes to talk to your academic advisor about and options to take during your first semester. We realized that a lot of you are pre-health students from a variety of different areas, from optometry to medicine to dentistry to audiology. So we want to make sure that you have some choices that you just can't go wrong with during your first semester. And that generally is chemistry and biology. If you took one or both of these, you're going to be perfectly fine for just about any pre-health area of interest that you want to go into. For chemistry, we have introductory chemistry, chemistry 1 in the lab, and chemistry 2 in the lab. Introductory chemistry, while it may sound introductory or fundamental, it really is a really great course. It does give you that fundamental, essential like building block that we hear a lot of times in pre-health students really allows them in chemistry 1 to grab that content and run with it and do really well in chemistry 1 and their very first big lab. Now you can click that link, which is the one I referred to in the last slide, and that gives you a really great way to evaluate whether you're ready for introductory chemistry or general chemistry 1 in the lab, which one you should start with. And again, you can always talk to your academic advisor, bring up your AP courses, bring up your transfer courses, bring up your community college courses, because that's going to be really helpful for them to help evaluate this next step with you. For biology, we have eBio and MCDB, which I know I'm using some lingo here, but you'll get the hang of it. But we have different biologies for you to choose from. These are going to work differently for different majors. So talk to your advisor about which one's best for your degree plan, and you can talk to them about the differences here, what covers which in more content or deeper level knowledge. For some of you, some of these are going to be better for you if you did have a lot of biology in high school or in transfer credit, and some of you may not have that experience, and so it's going to be better for you to take a different version. Either way, these are both great paths for you to get started, no matter what your pre-health area of interest is, and it really does set you up for success for some of the bigger classes that you're going to end up taking down the road. Also, all of these classes are going to give you that foundational knowledge that you're going to need for your entrance exam later. So you might take the MCAT if you're pre-med or the DAT if you're dental. These things come after your time at CU Boulder and help you get entrance into those professional schools. And yes, it will ask you on content from your basic level chemistry classes, which is why building that knowledge that you can then use for organic chemistry and physics and other courses is going to be really helpful for you down the road. We also have an extensive list of prereqs on our Office of PreHealth Advising site on the Explore tab. So if you go to our main site and just click the Explore tab at the top, you'll be able to click within those tiles and see all of the different prerequisites that are required or asked for each of your areas. Now that list, it is extensive. And what that means is that we've looked at a lot of different medical schools, for example, or veterinary schools or whatever it is, to make sure that we're giving you kind of the all-encompassing list of prerequisites. So again, if you're looking at specific schools or your heart's been set on a specific medical school for a long time, it might be in your best interest to consider taking a lot of the courses on our Explore page, because it will help you apply to the most schools you can when it comes time for that down the road. Right now, you don't necessarily have to go, crazy looking on all over the Explore page and just feeling really overwhelmed by all the courses there. We wanted to make sure that you felt really good about your first semester in these basic options, chemistry and biology. Okay, we know there's a lot to talk about with your academic advisor, and each advising unit has different ways of meeting with students. So here are some suggestions that we have for things that you might want to talk about with your academic advisor in regards to your pre-health plan. So I just talked about your foundational chemistry and biology courses, as well as which chemistry to start with, which biology to start with. You could also talk with them about exploring your major and the other options that might fit within that major, like minors and certificates. These are some of my favorites here on this little sticky note: public health certificate, neurosciences and behavior, healthcare and resilience, and social innovation. Those are all really great certificates and some of the most popular among our pre-health students. They're really great ways if, let's say, you want to be an IFI major, but you still want to dabble in psychology. You could get the neurosciences and behavior certificate, or you could get a psych minor. So it's a really great way for you to still get the different areas that you might be interested in. And these things can help set you apart as a pre-health student. IFI is one of our most common majors, but it's not our only major. And having a minor or certificate as part of your application can really help showcase a little bit more about you as a person and your area of interest. So it's a really great way to talk to a really great option to talk to your academic advisor about, because they can help you fit that into your plan from the very beginning. And it really does play into like your general education courses and whatnot. Now, Fatima, our pre-health ambassador, who is usually here for this slide, also talks about the importance of creating a 4-year plan to help give you peace of mind, and really utilizing both your academic advisor and your pre-health advisor to help understand your long-term goals and your 4-year graduation plan at the same time. Your academic advisor is really going to be focused on, like we said earlier, your graduation plan. They're going to have that mindset when they look at your 4-year plan. And your pre-health advisor might have a different perspective in terms of your pre-health goals, your career goals, when you're going to take the MCAT and how that's going to fit into your plans. So Fatima also talks about how it was really important to her to make a 4-year plan by herself first, so that she understood the prerequisites, the co-requisites, like all of these terms that you will learn, so that she could understand her own plan, bring that to her advisor, and then learn the gaps, the areas, the things that she needed to change. And she says that really helped just help her take ownership of it and just learn her major a whole lot more than she thinks otherwise. I think other things to talk about on this slide are talk about with your academic advisor are what college courses are like, how to study for them. Your academic advisor is not just there to help you with graduation plans. They also can help you with study tips or talk to you about challenging courses, traditionally difficult courses, and really help you understand the expectations that are going to be expected of you when you enter such courses. And as an former academic advisor myself, Katie is also a former academic advisor. We just wanted to give a little shout out to always being courteous and patient when reaching out to your academic advisor. They have a lot of students they're dealing with. Some majors are really big and some are really small, but either way, we really hope that as a pre-health student, you're treating them professionally and with respect and just taking your time. It's also really helpful to always email them with your student ID in your email, put your questions up front, thank them, and just really represent the Office of Pre-Health Advising and pre-health students in the best way possible, because we know that's the kind of person you are.
All right, some things to consider during your first semester. One of the things that I think is really important for students who are new to college or just new to CU, create a manageable schedule for yourself. So chances are you're going to be learning how to take on different types of classes. So these will be different than the classes you took in high school. This could be different than some of the community college classes that you've taken before. And you just want to give yourself time to adjust, because as Dana mentioned earlier in the presentation, GPA is really important to consider as a pre-health student. So when it comes to thinking about your schedule, it's not just about the courses, though you certainly want to think about how to balance those out well. You also want to take into consideration other things, like if you're planning to work during the semester, if you're hoping to get involved somehow, just being really mindful of how you're committing your time and making sure that you're putting those classes first so that you can get the strong GPA that you need. So your health professional schools will look not just at your cumulative GPA, but also at the GPA for your prerequisite courses. So you want to keep strong GPAs both overall and within those specific prerequisite courses, which tend to be science courses. Now, that being said, you can definitely recover from a rough semester because lots of students have them. We just want you to kind of start out on the best way possible. And so with all of that, also make sure that you're using the different support resources. Now, I'm sure that you're going to hear about this from a lot of different people, but it's really true. Use things like your professor and teaching assistant office hours. Check out tutoring on campus, especially because there's lots of free tutoring resources, whether they're specific to a department or available to students who are living in the residence halls. There's a lot of great options there. Other things that you might consider, the Writing Center, great if you need help writing college essays or writing papers that you haven't had to tackle before. And other things, academic coaching may be available for you, and if it is, you should definitely check that out. And also consider forming study groups with your peers, especially because as a pre-health student, that could be a great way to meet other students who are also pre-health, and eventually your study group could turn into an application support group where you're helping each other out along the way. So definitely take that into consideration as you're starting your first semester. And then you might also be thinking, like, how do I get connected? I'm excited to be coming to CU because there's a lot of opportunities for that. So definitely explore your interests within pre-health, but also explore things outside of healthcare that you want to do. So like we mentioned before, so Fatima is involved in multiple student organizations, not just pre-health related ones. There can also be lots of really cool volunteer opportunities, and some specific to CU Boulder. We have a volunteer resource center that can help you get connected to those. And then there are hundreds of student organizations, and a lot of them have different levels of participation. Not all of them require a big commitment. So that's something that I sometimes hear from students, is that they're worried that they don't want to join a student organization because they don't feel like they have the time. Some of them, and it does vary from organization to organization, but some of them are more social, or at least they're more social to start with, or maybe you help with one event that they're doing this semester. But unless you're going onto the board or are involved with a specific project, there are definitely some lower commitment organizations out there that can be a good way to socialize, meet people, and also explore your different interests. And so with getting connected, there's lots of opportunities to meet your fellow pre-health students. We're definitely going to be here to help you all connect as well. So through our different workshops, what I should know sessions, and those types of things. So look for emails from us. And also have fun while you're here. Don't feel like you need to do it all at once, though. There is a lot that goes into being a pre-health student, but you don't have to do every single thing the minute you set foot on campus. You've got time, and we're here to support you. So one of the things that you might be wondering, when should I meet with the Office of Pre-Health Advising? So this is sort of a general recommendation and just some things to think about as you're thinking about when to meet with us. I think that during your first academic year, especially after you've already met with your academic advisor, is a great time to meet with OFA. So say it's the fall semester, you've done your registration meeting with an academic advisor, or you've met with them to discuss some other things. And now you're like, oh, I've got some pre-health specific questions. That would be a great time to then set up a meeting with one of our pre-health advisors. Or if you've got any questions about what's needed to enter professional schools, maybe you've already explored our website and you still feel like you've got questions, that'd be another great time to connect with us. And then also, especially if you're feeling lost or feeling like you hit a roadblock. So maybe you explored careers on your own, but want to talk through a decision. OFA pre-health advisors are here for that. We can also help you if you want to weigh the pros and cons between different opportunities. Now, you'll still be the one who has to make the decision on that opportunity and choose what you want to do, but we can help kind of be a sounding board in that situation. And other things that come up, maybe you've always thought you wanted to pursue medicine, but now you're not so sure and want to know what to do. We're another great resource if you just need to talk through these types of problems or any other problem that comes up.
So we know many of you are excited to get started on your pre-health journey. Just remember, everyone takes this journey at their own pace and on their own timeline. However, if you're hoping to jump in this summer or looking for some things to get ahead or start doing, or you just want some quick advice, this is the slide for you. So these are some ideas for summer. You could be looking into shadowing or volunteer opportunities that might be near you. We recognize that you come from lots of different hometowns from across the world. So you can definitely shadow or volunteer anywhere. It doesn't have to be at CU Boulder or during your time here at CU Boulder. You can shadow or volunteer at your hometown. And actually, this is a great opportunity because how great would it be for you to shadow right now this summer at, like, let's say your local PT clinic, and then you go back next summer on summer break, or you go on winter break and you shadow again and you shadow again. They're going to write you a fantastic letter of recommendation. They're going to know you for many years. That's amazing. And that doesn't always happen for a lot of students. Also, I want to say that when you fill out your application for pre-health professional schools, you're not going to be able to use your high school experiences. You're only going to be able to use your college experiences, but you get to use this little summer time right now, this like in between time. So if you've already built up a lot of shadowing hours or a lot of contacts, maybe now is the time for you to do a couple extra hours or go back to that office and just do some more time with them so that you can put that on your application. You can start that experience now for your future application. Also, volunteering opportunities during the summer is fantastic. If you're passionate about specific things, or let's say you're a pre-vet student, you have to get hundreds of hours, and we'll fill you in on that later, but hundreds of hours of volunteer experiences or hands-on experiences working with animals. And so what better way to start that now than this summer? It can really help you build connections and network, and you never know, those people could introduce you to someone else that you could shadow or another connection at CU Boulder. And so it's really a great way to just build up that support. You could also get certified for a job in a lot of different healthcare fields. We know that this comes with a lot of different community college students who transfer here. They may have already done this, or high schools actually are giving out like training on how to get their EMT and those kinds of things as well. So if you haven't done that and you're not ready to take on this job, but you just want to get the license, this is a great time to do it. You could become a farm tech, medical scribe, certified nurse assistant, CNA, lots of different ones there that can give you great experience with valuable hands-on patient care experience that you might need for your future career. And just as a note, these certifications can vary state by state. So if you do want to practice in Colorado and you're not from Colorado, this might be something to consider waiting on. But if you're just curious and you want to learn more and it does work out, this is another great option to do this summer. You can also work a summer job. A lot of students ask later when they're going to fill out their application, you know, oh, I've been working at Starbucks for the past 2 years. They don't want to know that, right? They don't need to know that I worked at Starbucks. No, they totally do. They want to know that you worked at Starbucks because you've built up some really great skills. You've built time management skills, showing up for your shifts, you know, covering for colleagues, whatever it might be, dealing with angry patients, clients. See how these things overlap? So you're going to be able to have these transferable skills from that job, working with lots of different people from various backgrounds and experiences. And that's going to be really great for your application one day. Also, we really encourage you to journal and reflect on your experiences. I know that this might seem like, okay, yeah, this is just a bullet point for everybody to hear, but it really does matter when it comes time for you to write your personal statement about 4 or 5 years from now. You have to write about experiences with patients or experiences with different people. And sometimes it's really hard to come up with those examples if they don't stand out in your mind. So shadowing and volunteering and working, I want you to be journaling. I want you to be writing down what was meaningful for me during that time. What did I get out of today? And guess what? Not all of your days are going to be stellar and they're not all going to be amazing. That's okay. you build up this practice, this habit of journaling. It's going to come naturally to you when it comes time for you to write that personal statement, because you're going to have years of built up experiences that you can just sift back through and find the best ones to write about. And then also this summer, you should attend our WISC What I Should Know sessions to learn more about different healthcare professions. You should keep reading our listserv, and you can complete the Canvas course that we talked about. And that course is in quotes because it is not an official 4-credit course, but it is part of a course that we ask all pre-health students to complete that really helps set you up for success in conversations with your pre-health advisor. I also want to say that it's okay if this does not line up with your summer plans. You still have plenty of time and opportunity to build up impressive opportunities and experiences to go on your resume and be part of your application to professional schools. It is totally fine for you to be exactly where you are, which is right here, right now, watching this webinar and doing whatever you want to do this summer, whether that's traveling, hanging out with friends or family before you come off to college. That is totally fine. It is not uncommon for us also to work with students later in their junior, senior, even the year after they graduate, to say, hey, I'm now interested in this profession. What do I need to do? So those students might be starting from scratch, years from now. So even if you're not doing something this summer, it is completely fine for you to just take your time and do what you want. We do recognize, however, a lot of you are ready to get started. And so we wanted to give you some options to consider this summer.
All right, so coming back to these What I Should Know sessions that Dana just mentioned. So the information on these is available at the bottom of the Prepare section of our website, and that's got the most up-to-date information on our upcoming WISC sessions. And actually, I'm going to navigate over to that page really quickly just so I can show everybody what I'm talking about. So this link is taking us directly to the events for pre-health students. And so what you can see on this calendar is we've got some other information, but anything with OFA at the beginning is one of the things that we're offering. So we've got OFA WISC sessions about medicine. We've got some about becoming a physician assistant, about nursing, about physical therapy, and soon we'll be building out our July calendar of WISCs as well. But this is where you can go to see when they are and what the subject matter is. Now, if you want to sign up for those, I would like you to just go ahead and send me an email at prehealth@colorado.edu and include your student ID number, and I'll be able to get you signed up. So right now, the next steps for you are, we're going to have you added to our pre-health advising listserv, where you'll get a lot of really cool information from us about things like events and those things that are going on. The What I Should Know sessions, I think signing up for one of those this summer would be really, really awesome and super, super beneficial for you. We're also going to add you to that Canvas course. Now it's going to be called Pre-Health Foundations Canvas course. And that's got some more information about how to work with our office and the specific services that we offer. It's something that we talked about a little bit towards the beginning. In that Canvas course, it would also be fantastic if you go through and complete the pre-health designation quiz. And then later on this summer, once that quiz has been completed, we'll be able to add the pre-health designation onto your account. All right, so if you have any questions, feel free to email us at prehealth@colorado.edu. And again, we'll make these slides available for you so that you've got access to that email address, but we will be happy to talk with you more. Thanks everybody for watching this webinar.
Thanks everybody, see you soon.